Want to know what TeleNeurology is all about? Well, imagine this. You or a loved one suddenly can't move one side of your body. Your speech is slurred, and you rush to the hospital, but there's no neurologist there to help. What happens then? The situation is more common than you think. Many hospitals, especially in rural areas, don't have neurologists available 24/7. That's where TeleNeurology steps in. I'm Dr. Swathi Lorayakoon. I'm a vascular neurologist who has treated thousands of patients remotely as I practice in TeleNeurology and telestroke. Today, I'll show you how it works, why it's so important, and what really happens during a TeleNeurology visit. Across the United States, there are about 1,800 hospitals in rural areas. These are what we sometimes call medical deserts, places where access to specialists is very limited. But it's not just rural areas. Even some big cities face a neurologist shortage, since neurology is one of the most understaffed specialties. So, if someone comes in with a stroke, seizure, or another neurological emergency, waiting for an in-person neurologist could cost precious time. And when it comes to the brain, time is everything. This is where telemedicine, and more specifically, TeleNeurology, saves lives, saves brains. A teleneurologist is a fully trained, board-certified neurologist who examines and treats patients remotely using secure video technology. Many teleneurologists, like myself, are also fellowship trained in vascular neurology, which means we focus on stroke and other urgent brain conditions. During the COVID-19 pandemic, telemedicine became even more vital. Hospitals built the systems and workflows needed so specialists like me could connect with patients virtually. And now that system is here to stay. What happens in the ER visit? Here's what it looks like in real life. The ER team wheels in a cart with a video monitor, or sometimes it's just an iPad. I will log in from my end through a HIPAA secure platform. The bedside nurse helps me perform the neurologic exam. Most of the exam I can do by observing the patient on screen. Things like movement, speech, eye tracking, but for some parts, like testing sensation or checking visual fields, I need help from the nurse at the bedside. And sometimes, if the patient's sleepy, the nurse has the fun job of trying to keep them awake while I ask my questions. Whether I'm in my office or working from home, I treat every teleneurology visit with the same professionalism and care as if I were standing in the hospital room besides my patient. Your privacy, your dignity, and your safety are always the priority. So now you know what teleneurology is, why it's such a powerful tool to bring life-saving care to patients, no matter where they are. If you found this helpful, please hit like, subscribe, and share this video with someone who might benefit. And if you'd like to learn more about strokes, one of the most common emergencies I treat, please check out my video on the next topic. I'll link it right here. Thanks for watching.